Hey guys, it's Dr. J in the house. We were trying to do a podcast here, but we had a little technical difficulties. So we're going to try to get our guest back here at the end of the day. But I'm going to do a little live Q&A. I got some Q's to your A's, so let's see what we can do. Let some listeners kind of come in, let the group get a little bit bigger, and then we'll roll through it. So what's on y'all's mind today? It's a nice little Friday here in Austin. Not too bad. The weather is my favorite time of year. Not too hot, not too cold. Look forward to connecting with y'all. Let me get the camera a little better here. Yeah, perfect. Love it. All right. What do you guys want to chat about? We just did a podcast this morning at the Candida Summit with Evan. I was able to host his Candida Summit, which is great. So if you guys tuned in, make sure you subscribe to candidasummit.com and check out that podcast from this morning. Let's let some chat questions come in, guys. I'm here for you. I got a patient in just a few minutes, so let's see if I can help you all out on this great Friday. What's cooking? What's on your mind? What's happening? Lots of things always happening in the functional medicine world. Lots of people talking about, let's just see. SIBO is always a hot topic. Cancer prevention is always an amazing hot topic to chat about. One of the best things you can do for cancer prevention is keeping your blood glucose in check, being more of a fat burner, having more ketones that you're burning off of versus sugar, keeping yourself more insulin sensitive, right? The higher your insulin, the higher your blood sugar, the more you are going to feed cancer. And of course, just not putting carcinogens into your body like pesticides and Roundup, glyphosate, those type of things are going to be always going to be stressful on the body. Do you have any blockers for EMF or radiation for the iPhone or when you use it? Well, great question, Sam. So off the bat, I keep a Q-Link on the top corner of my iPhone. So that's number one. Number two, I try to always use a headset. I do a Bluetooth from time to time just because it's really convenient. May not be the best, but it's much better than talking right up against your ear. Never talk against your ear, either speaker, Bluetooth, or you can do the wired connection. And then also I have a holster for my phone. So I keep it like this, really simple, and I put it on my hip. What you can do is you can get a holster like this. I haven't done it yet, but you can put a slit in the side, and then you can put aluminum foil in between the holster and your phone, and that will prevent any EMF at all. Again, I'm not worried about putting it like, let's say in the back by my glute, because I got, a whole bunch of tissue and muscle there. I'm not worried about that. It's not next to, let's say my testicles, or it's not next to my brain or any like neurological tissue that's sensitive, right? So cell phone in the pocket, that's next to your junk. Cell phone next to your head, next to your brain. So next to your hip or next to your, where your glute is, I'm okay with that. So that's kind of how I do it to prevent that from being an issue. Noah writes in, hey, Noah, how you doing? Esophageal reflux, worse after going low FODMAP, AIP, and starting enzymes, coughing all night, throat burning. Hiatal hernia may be a factor. Should I lower the dose of the enzyme? So anytime you're having sensitivity issues, always start low and work your way up. Always start low, work your way up. Make sure you're using cooking methods to pre-digest the foods. Anytime the foods are easier to digest, meaning kind of crock pot or soup kind of based, will be better for you. And that's going to be the best thing. And of course, avoiding a lot of the raw stuff. And you may have to start adding in some acids too. So if you're just doing the enzymes, you may want to start adding in some acids, whether it's some apple cider vinegar or some bitters, or even just some straight up lemon juice to help. That may be a really, really good option for you. Keep me posted on how that works. Amy writes in, usually how long are your protocols for getting rid of Candida? Typically 2 to 3 months. It depends what kind of infections are present. If it's just Candida, or if it's Candida with the bacterial overgrowth, or Candida, bacterial overgrowth, H. pylori, and a parasite. So it just depends. Noah writes in, thanks for the fresh content quote. Appreciate that. Ramona writes in, can you explain the food combination, fruit and protein? So the whole idea is that fruit doesn't need much time in the stomach for the digestive process. So if you eat like protein and fat and then you take in fruit, the fruit's going to sit in your stomach for longer and ferment and kind of like create a fermentation thing because it just sits there too long. So they say have fruit away from things because then it can leave your stomach in like 5 minutes or less and then go into your small intestine. So I typically tell people that may be good for you if eating any fruit causes lots of bloating or gas. There could be like a fructose malabsorption that's causing problems. It's hard to say. So I would just listen to your body. And if that's the case, then maybe have some fruit like an hour after you eat. That way you've given yourself a chance to empty the stomach out. It takes about an hour for the stomach to start to empty. And that way the blood sugar is not going to get too messed up. And then you can do fruit in an hour later if you are feeling that the fruit is causing some bloating or gas or some maldigestion. And they talk about do not having mixed fruit due to fruit digesting exactly faster. Yep. Yeah, they talk about having smoothies with berries. I think you just have to figure out if it's an issue for your remote. If it's an issue, then you can just, separate it out. If it's not an issue, I wouldn't worry about it. I find most people it's not a problem, but if you have a lot of digestive issues, then you may want to follow suit. Connor writes, and does CBD help with RA? I think CBD can have some really good anti-inflammatory benefits with RA. Of course, with RA, you want to cut out the nightshades. You really want to go on an autoimmune template. You probably want to get some really good anti-inflammatory supplements on there. Like in my line, we use the curcumin supreme, which is liposomal curcumin, which is 6 times better absorbed. You can always do boswellia. You can do enzymes, systemic-based enzymes away from food to help with inflammation. That's helpful, but you want to work on the diet. And yes, CBD can be one of those things that you add in for sure. Don't forget the infections. Don't forget the infections, mycoplasma, Prevotella. These are all bacterial issues that can cause lots of joint pain. See here, Noah writes in, Oscar writes in, can a woman whose breakfast has shrunk come back to normal size in a ketogenic? So can a woman whose breasts have shrunk come back to normal size? Those are women that have experienced it. So, I mean, typically, if we're talking breast shrinking, I mean, are we talking a menopausal female whose hormones have dropped and that's the tissue has dropped? Yeah, it's possible for sure. I mean, if we get the hormones balanced, you can see some improvement in like the breast tissue integrity. Of course, like if there's been breastfeeding, the woman's already breastfed and stuff, getting collagen in there and helping that connective tissue will help. Jeff writes in, I'm on oxycodone now while taking the herbs for H. pylori. It helps my anxiety. I die off a lot. Plus, my wife still has the infections and keeps passing it back and forth. What can we do to get this in check? Got to get your wife on the plan, man. If your wife's not on the plan, it's going to be an uphill battle. Of course, with oxycodone, do you have chronic pain, Jeff? What's the pain issue? I would try to not get stuck on oxy. Don't be like the 40,000 Americans that die a year because of it. I mean, that's a nasty, nasty drug. That should be an absolute last case scenario. Use all the natural things that we talk about, that I talk about, systemic-based enzymes, curcumin, boswellia, frankincense, beyond all those natural things to help. Bone broth, collagen to help with the inflammation, fish oil. Don't get stuck on that stuff and get your wife on the plan. Dr. J, what's your favorite bitters? I mean, typically I have a couple formulas that I use. It's called Bitters Tonic, but it's got some of the gentian root in there. It's got some ginger. It may have some orange peel in there. It may have some anise. But these are some really good things that stimulate natural acid levels. If people can't tolerate hydrochloric acid, like external hydrochloric acid, then we'll give some gentle herbs that will stimulate hydrochloric acid in the guts. So you can always try like some gentle acetic acid from apple cider vinegar. You can just try some lemon juice and just do a shot of it 5 minutes before you eat. If any of that really hurts your gut, you probably have atrophic gastritis and you got to be careful because your gut lining is just super thin. So just try to dose it according to what you can tolerate. If the enzymes cause problems, go back to the acids. Start low, work your way up, and of course, work on all of the healing, soothing nutrients for that gut lining. Noreen writes in, should I do a GI map or a doctor's data test? GI map for sure. The doctor's data test is not genetic. It's not a genetic-based test. It's going to be a stool antigen test, and it will not be as comprehensive. There's some good markers there, but it won't be as comprehensive. Ali Mo writes, in any chance you could talk about pet health someday? Sure. I mean, I have a dog, my dog Butter. Where did she go? I think she's out in my the family room. But Butter's great. She eats, and my cats. So my cats get a piece of bacon every morning, pasture-fed bacon. They need a little bit of dry, so we use a dry called raw, and it's 100% grain-free. It's low carbohydrate, and that's helpful. So they get really good, human quality meat in there that's dried up. They also get a pack of tuna every night. I try to keep it grain-free. I try to make sure that it's human grade because most pet food is just absolute nastiness. It's like the food that you cannot legally sell to humans, so they sell it to pets. And one of my cats, Misha is like 14 years old, no health issues. My cat Dexter, he's almost 9 or 10, and he's an orange tabby. He's in pretty good shape. He's pretty big, pretty heavy dude. He's like 23 pounds, but he just like, he just has a huge head. The vet says his head's like 40% bigger than most cats. And then my dog Butter, who's 2, she's in great shape. It's tough with her because she gains a little bit too much weight because the cat dry that sits out, she always sneaks in there and eats a little bit too much of it. And I think she just really needs pure meat, nothing else. But hope that helps. Always high quality foods. Spend more money on your pet's food, and then you'll spend less money on the vet bill. I promise you. Let's see here. AIP, I still feel hungry, run down all the time. Is it possible to almost be having withdrawal reactions from cutting out all the sugar and bad carbs? It's very possible that that's the case. When you go AIP, number one, make sure you aren't lowering your calories. A lot of people, if here's your diet right before, and like this percent of your diet's crap, and then you're trying to sub this with AIP foods, and then now your calories drop. If your calories drop, you're always going to feel more tired and run down because you're not getting enough nutrition. So number one, make sure that you are getting enough calories. Run your foods through Chronometer, justinhealth.com/chronometer, CRONOMETER. Run it through there. Make sure you know what your caloric needs are. Set your age, your weight, your activity level, and then see what your calorie needs are. And then from there, you can adjust it accordingly and just put your foods in and make sure you're getting enough. The next thing is if you're still really tired still, you can just try to match your macro. So if you're going really, really low carb, you may just have to see it through because you're kind of fat adapting. But if you're not going really low carb, you may just have to match your macronutrients, meaning if your macros were at a certain level, just try to sub out those foods and keep the macros, the protein, the fat, and the carb percentages at a similar level. That's a good way to do it. Where was I here? Any chance you could talk about pet health? Yep, I did that a little bit. Jeff writes in, I have degenerative disc disease like my dad and sister. I'm taking L-glutamine, ginger, and I'm trying to get the wife and dad to stop smoking cigs. Yeah, so I mean, you just got to do all the natural stuff, man. I would invest in a really good decompression table. You can look on Amazon for a really good one, and then look at some of the foundation training exercises by Dr. Eric Goodman. But you really want to stay away from that stuff, man. You want to get on a healthy diet and lifestyle, get your gut fixed, get on the collagen, all the nutrients, and stay off the oxy. Do not get on there unless it's an absolute must. You need to be working with a physician whose goal is to not get you addicted to it. Be very, very careful. You're messing with fire. Okay, Jeff writes in, sewer system is busted, airborne exposure right now behind the house. Yeah, man, you gotta get on top of that stuff, dude. A lot of problems. Got to jump on top of it. Any last questions, guys? Let me know. I'm gonna jump on to a patient call. I'll give you 30 seconds here to chime in. Anything else on your mind? What else is cooking, y'all? What else? Let me know. But again, anyone that has pets out there, really take care of your pets from a nutritional perspective. Again, you may think, well, I'm saving money on it. You're not, because if you just get one big vet bill, I mean, that could be $1,000. That could wipe you out. You know, all the savings that you had from having crap food, it's all gone, right? Plus, it's good quality of life for your animals. See here, I picked up a teeter totter at Costco last month, and this cured my TMJ and neck pain. So teeter totter, a teeter, is that like a decompression? That a decompression thing, Sam? Let me know. And if it is, then that's maybe a good one to try there, Jeff. Look at the teeter at Costco for decompression. Amy writes in, what did you eat today? Today, pretty simple. Today was just really good organic coffee, MCT oil, and collagen peptides. I had a collagen bar this morning. I'll have a green drink of just some green veggies, juiced up here in a bit, 4.5 pounds worth to get my antioxidants. And I have some fish sticks for lunch. I have some homemade tartar sauce from Mark's Primal Mayo, and I have some really good fish with a like a nut-based coconut almond flour coating. So that'll be lunch, and I may do some steaks on the grill tonight. So absolutely. You are totally welcome, Noreen. Do you ever take liposomal glutathione? Personally, I do. I have some in my fridge. I do it from time to time for sure, especially if I get any toxic exposure. I'll also take charcoal for any questionable foods as well. And I do a detox a couple times a year where I'll do like my detox aminos, my liver supreme. I'll hit the sulfur and phase 1 nutrients hard to really push those pathways to help detoxify. I mean, I think it's good. We live in a pretty toxic world just with the gasoline fumes, right? Those are all polyaromatic hydrocarbons and various stressors there. So I want to make sure that I have good detoxification systems running to push those things out. All right, guys, hope all is well. I will be back later on today. I'm going to do a podcast at 5 p.m. CST with Kevin. So apologize for not making this work. I figure I'd jump on, do a quick Q&A for you all. And then I'm going to be back in, let's see here. Today, right now, it's almost noontime, or it's a little past noon. I'll be back in a little less than 5 hours. So if you want to tune in then, I'll be back. Let me rock out these questions. Is juicing fruits and vegetables okay for AIP diet? Anything to be careful about? It's okay. Just make sure you're doing only vegetables. So like the ones I'll be doing are going to be celery, kale, spinach, cilantro, and then maybe a little bit of ginger or a lime. That's it. And you got to be careful. I do no extra fruit, so the sugar is as low as possible. Can the anxiety be coming from the thyroid though? My wife has developed bad panic attacks. She's out now stuck on amitriptyline and diazepam. Well, it's hard to say, Jeff. Your wife's diet's terrible. So, I mean, it's so hard to know what could be the issue. Of course, with her terrible diet, it could be causing thyroid issues. It could be causing adrenal issues, just blood sugar swings. Too many issues to really know. But you'd have to clean things up first and then see how she does. Please do another Q&A. Absolutely. We'll doing them every week. I'm making sure I'm here for you guys. You guys are totally welcome. And the Alimo, yeah, if you can't join in, don't worry. It'll be recorded. You can always tune in tomorrow. John writes, I just found out about my adrenals, lost my job, excited to get started. Sorry to hear about the job loss. Just continue to work on the sleep and the nutrition, get some good adaptogens. Hope that helps, guys. Hey, phenomenal chat and be back in 5 hours. Have a phenomenal Friday and a great weekend. Talk to you soon. Bye, y'all.